In the first section of our lecture, now we will start with the anatomy and functions of facial nerve. In this section, we will talk about the anatomy, and then we will talk about the course of the facial nerve and what are the branches of the facial nerve. Then we will talk about the blood supply and surgical landmarks of facial nerve, and then what are the different variations and anomalies that can occur in the course of facial nerve. So first, the facial nerve. This is the diagram that gives the picture of facial nerve. Facial nerve is a cranial nerve. Facial nerve is seventh cranial nerve. There is a total of 12 cranial nerves that perform different functions, and in them the facial nerve is among them the seventh cranial nerve. So this is the facial nerve, and then very close to this is the trigeminal nerve. And these are the branches, facial nerves. We will talk about the branches later on, but this is the diagram that gives about 5 further branches, big branches. Smaller branches goes to different structures or the different parts, but the main 5 big branches of the facial nerve, these are the branches, 1, 2, 3, 4, and 5. So these are the branches of cranial nerve 7, which is facial nerve. And this is the diagram that gives the picture of motor cortex, and then the thalamus, and then it comes out of the motor cortex and then goes to the nucleus of cranial nerve 7, and then from that nucleus the information is relayed to the face, and then there is towards the buccal region and then the forehead region. So this is the normal path from the thalamus, motor cortex goes to the cranial nerve nucleus, and then from there to the parts which is innervated or by the facial nerve. Next, what are the functions of the facial nerve? Facial nerve perform lot of functions, and as the name shows, mainly it supplies or affects the muscles of the face. So nerve supply, mainly facial nerve, is associated with muscles that are responsible for different functions of the facial expressions, and then taste limited to the 2/3 of the tongue, and then secretions from the lacrimal gland and some mandibular and so all these are the different functions. So let's go over them briefly. So the brachial motor, which is special visceral efferent branch, it supplies the muscles of facial expression, posterior belly of digastric muscle, and also stylohyoid and stapedius. So all these are the structures which are supplied by special visceral efferent. We have two afferent part and the efferent part. Afferent nerves carry information to the brain, and efferent carry from the brain to the different structures. So this is special efferent, visceral efferent. So it supplies to the muscles of facial expressions, all the facial expressions, frowning, and all these are caused by the facial expression muscles which are supplied by facial nerve. Then the other branch, we have visceral motor. This is general visceral efferent. So one was special, one is general. General is parasympathetic innervation of the lacrimal, submandibular and sublingual glands, as well as mucous membrane of nasopharynx, hard and soft palate. It's a motor nerve, general visceral efferent, so it is responsible for the different motor actions of lacrimal, submandibular, sublingual glands and mucous membrane of the nasopharynx, hard and soft palate. Next, we have the afferent. Afferent carries information to the brain. So we have special afferent. Taste sensation are carried from anterior two-thirds of the tongue, hard and soft palates. General somatic afferent is general sensation from the skin of the concha of the auricle and from small area behind the ear. So these are the functions of facial nerve. Functions are further divided into functions carried by efferent and afferent vessels. Efferent carries information from the brain to the structures. Afferent carries from the different parts to the brain, and all these are carried out by facial nerve. Next, what's the course of the facial nerve, how it runs? The course of the facial nerve is roughly divided into three parts. One is intracranial, which is in the cranium or in the skull. Then we have intratemporal, in the temporal region, and then extracranial once it comes out of the skull. So intracranial is from the pons to internal acoustic meatus. So intracranial part is into two segments from pons to internal acoustic meatus. This is the picture showing the nucleus of cranial, motor nucleus of cranial nerve 7th, which is the facial nerve. So motor nucleus of facial nerve, and then there is nucleus of the 6th nerve, which is there. So this is the intracranial part. Then we have intratemporal part. Intratemporal part has 4 segments. There is meatal segment, meatus, labyrinthine, which is the inner ear. Then we have tympanic, and then mastoid. So intracranial starts from the pons, goes to internal acoustic meatus. From there, intratemporal part starts, which is the part mainly that has the ear components or segment. Then these segments include the meatus. Then we have labyrinthine, tympanic, and mastoid segments. Then the final segment is extracranial part, which is from the stylomastoid foramen to the termination of its peripheral branches, where it divides into branches, and you will see the different branches of facial nerve that supplies the different parts of the face. So this is the course of the facial nerve. Stylomastoid foramen is a small opening through which it leaves the intracranial and intratemporal part and comes into the extracranial portion. So facial nerve has 3 components of its course. We have intracranial component, an intratemporal component, and then extracranial component. Intracranial starts from pons to internal meatus, acoustic meatus. Intratemporal has 4 components. We have meatal, labyrinthine, tympanic, and mastoid. And then extracranial, when it leaves the comes out of the stylomastoid foramen and reaches until it divides into peripheral branches. Here starts from the pons to internal acoustic meatus. Then it has 4 segments of intratympanic region. We have meatus, meatal, labyrinthine, Then we have the tympanic and mastoid. And then the terminal branches. This is like a foramen from which it comes out and divided into peripheral branches. So that's the very simple course of facial nerve. Next, branches of the facial nerve. These are the 5 main branches of the facial nerve. Here X represent the exit from skull. Here it leaves the skull and then it divides into 5 branches. One goes to the forehead. This is the temporal branch from the temporal region. Temporal. Then there is zygomatic. Zygomatic is this region. This supplies zygomatic region. Then the buccal region. Buccal is the around the mouth region, buccal. And then fourth is mandibular branch. Mandible is the jawbone, so it's mandibular branch. And then fifth is in the cervix or the neck. So this is roughly the position of the facial nerve. That's how they represent here. So there is first temporal, then zygomatic, this area, then the buccal, then mandibular region and cervical. So these 5 fingers represent the 5 branches if you put them like this. So forehead, this is the temporal branch, zygomatic branch, buccal branch, then we have mandibular branch and cervical branch. These are 5 branches of the main 5 branches. Small branches are given to the different parts. We will talk about that. So then facial nerve gives a small nerve innervation to greater superficial petrosal nerve, nerve to stapedius, nerve to chorda tympani, then there is communicating branch, then posterior auricular nerve, muscular branches, and peripheral branches. These are small other branches or nerves given by the facial nerve besides the 5 main nerves. We have nerve to petrosal, greater petrosal nerve, stapedius nerve, nerve to chorda tympani, communicating branch, then posterior auricular nerve, muscular branches, and peripheral branches. So these are all the branches of the facial nerve, the main 5 branches which supplies to the face. We have temporal, buccal, mandibular, cervical, and zygomatic, 5 branches. Next, blood supply of the facial nerve. Blood supply of the facial nerve, we have first, this is the anterior inferior cerebellar artery. Anterior inferior cerebellar artery, then labyrinthine artery supplies the facial nerve. Then we have superficial petrosal artery, and then stylomastoid artery. So these are the 4 main arteries or the arterial supply or blood supply of facial nerve. There is anterior inferior cerebellar artery where it leaves the cerebellopontine angles. Then at the internal auditory canal there is a labyrinthine artery. Then lower down there is superficial petrosal artery at the geniculate area. Genu is the knee, so where it forms the curve, there first genu, there is superficial petrosal artery, then stylomastoid artery. So all these are the arteries that do the blood supply or give the blood supply to facial nerve. Next, surgical landmarks of facial nerve. These are again the pictures that shows this is the exit Here, from the stylomastoid process, the facial nerve comes out of the skull. Then here it divides into 5 branches: temporal, zygomatic, then we have buccal, mandibular, and cervical branch. Divide into 5 branches. Surgical landmark of facial nerve. If suppose surgery is performed on the facial nerve, surgical landmarks are important from how we can access the facial nerve to avoid any injury or damages. There is one landmark is processus cochleariformis. So this is processus cochleariformis from the term cochlea. Then the another is oval window and horizontal canal. Then there is short process of incus, pyramid, and tympanomastoid suture, digastric ridge. These are the landmarks of the surgery performed on facial nerve. Processus cochleariformis, oval window and horizontal canal, short process of incus, pyramid, tympanomastoid suture, and digastric ridge. Next, parotid surgery and the landmarks of parotid surgery. The parotid gland, this is the parotid gland, and this is the parotid gland plexus, which is formed by the facial nerve on top of the parotid gland. Parotid gland, and these are the circles. So it's the landmark. If parotid surgery is performed, the surgical landmark to avoid injury to the facial nerve, its parotid gland is not supplied by the facial nerve, but it forms a plexus on top of the parotid gland. Posterior auricular branches and posterior belly of digastric muscle. So the landmark for the parotid surgery, we have cartilaginous pointer, tympanomastoid suture, styloid process. Styloid process is behind the ear here. And then there is posterior belly of digastric. Posterior belly of digastric muscle. This is posterior belly of digastric muscle. So these are the 4 landmarks for parotid gland surgery. Now let's talk about some variations and anomalies of the course of the facial nerve. What can happen? This is the normal presence or position of the facial nerve. This is the facial nerve, this is the first genu or turn, and this is the second genu of facial nerve. This is the horizontal canal, and this is the oval window and the round window. So that's how the facial canal runs between horizontal canal and oval window. If there is bony dehiscence, if there is abnormality of bone and there is dehiscence, that's how the facial nerve comes and lies close over the oval window. And surgery should be performed to remove this dehiscence and to free the facial nerve. Then another abnormality, if you see, this is the posterior hump. Hump is formed in the second genu of the facial nerve. This is hump produced in the genu of facial nerve. Few other abnormalities, this is bifurcation. The facial nerve at the end is bifurcated into 2. branches. This is two parts. So bifurcation. Then we have trifurcation. It's divided or branched into three parts. So trifurcation. Another complication can be if there is bifurcation and reuniting around the oval window. You can see this is the facial nerve. It is bifurcated into two, and that bifurcation is reunited again around the oval window. And then there is tympanic segment crossing between oval and round window. So this is another, it's the segment that divides across between round and oval window. This is the normal location or normal course of the facial nerve. But instead of that normal, this is going, a segment is going between the round and oval window. So all these are the variations that can occur in the course of facial nerve between horizontal canal and oval and round window. And these variations can different problems and complications. Next, the structure of the nerve. The nerve is nerve fiber consists of axon, myelin sheath that covers the axon, and then we have neurolemma and endoneurium. If you see, these are the cross section. This is the nerve. We have perineurium. This is pink is peri. Peri means around the neurium. Endoneurium is the inner layer, and then epineurium. So three layers of the nerve: perineurium, endoneurium, and epineurium. Endo is the inner, peri is around, and epi is out. And then if we do the cross section of the nerve, how the nerves look like in the cross section. This is the inner part, this is the axon, myelin sheath which covers the axon. Then we have neurolemma and endoneurium. This is how nerves look like on the section. These are the part: axon, myelin sheath, neurolemma. This is neurolemma, and then endoneurium. This is endoneurium. These are the Schwann cells present in the nerve, and then there is node of Ranvier. This is the structure of the nerve. Consists of axon, myelin sheath, neurolemma, and endoneurium. Severity of nerve injury. The injury to the nerve depends on the degree of the injury and what functions are performed by the nerve. Usually three common presentations are present. We have neuropraxia, exonotomis, and neurotemesis, exonotomesis and neurotemesis, and neuropraxia. And in this neuropraxia is the both sensory and motor fibers are damaged. It's not permanent. It can recover within few weeks after the injury. So this is neuropraxia, and both the motor and sensory reflexes or stimuli are affected. In exonotomy, as the name shows, axons and myelin sheath both are affected, and in neurotomy again nerves are affected along with their nerve sheath. So all these, the signs and symptoms of these depend on the severity of injury, and it can cause weakness and numbness and tingling that can be caused by any nerve injury. So that was all about section 1. Thank you for watching sqadia.com.